Welcome to the Surgical Assistant Podcast, a podcast crafted by surgical assistants for surgical assistants, where professionalism meets passion. Hello, welcome to the Surgical Assistant Podcast. I'm Kelly, and joining me is John, as usual. Hey, John.
Hey, Kelly. How are you? Happy holidays.
Hey, you too.
Merry Christmas.
Yeah, we're right here at it. Coming up on it fast. I was just driving home from work and looking at Chris and whatnot and thinking, it just goes so fast. I feel like I don't know, maybe it's our profession, our profession is unique to it, but I feel like we fly through it quicker just because I can say from my perspective, we get so caught up in what we're doing at work and doing
That's true.
cases and taking care of patients. And I feel like we get tunnel vision. And then before I know it, we're through the holidays and through Christmas. And you have to be really intentional about enjoying this time with friends and family and embracing it. One way I try to do that is listen to Christmas music as much as I can. But I know that can be annoying. I even need a break from it. I don't want to listen to it every minute of all day long, but that helps me. What do you like to watch Christmas movies too?
I got the Sirius XM holiday traditions. I listen to that in my car while I'm driving around. And I do watch Christmas, obviously, the big ones, Lethal Weapon, Die Hard, It's a Wonderful Life.
Oh, yeah.
Definitely It's a Wonderful Life and Rudolph the Red-Nosed Reindeer.
Yeah,
But I'm really upset because Amazon makes you pay for those now. I couldn't find them on Hulu or any of that. Yeah, I had to go to Amazon Prime and buy Rudolph the Red-Nosed Reindeer to watch it.
Literally,
Yep.
But you know what?
But it's worth it.
Yeah, and they know there's
It's worth
value
it.
in it because people are looking for that
Oh, yeah.
nostalgia, and that reminds us. I
Yep.
know it. We're the same
And A
age.
Christmas Story. You don't have to pay for that one, man. I love watching A Christmas Story. Some people hate it. My mom hates it. I don't know why.
That's a
but
good one. That's a
I
classic.
love that one. Yep. And
I
Home
like
Alone.
it.
I can only
The
watch that
Home
one
Alone.
once, but there's I have my favorite Christmas movies that I like to watch. Die Hard is probably my favorite Christmas movie.
Yeah.
I have a shirt too that says Nakatomi Christmas Party 1987.
Oh, that.
Nakatomi Plaza. And then I have one that says now I have a machine gun, ho ho.
Oh, yeah.
But it's packed away in storage. I would have had it with me this time. I forgot to dig it out when I was traveling, but
So yeah,
I love
that's how I
Christmas
try to
time.
keep myself remembering that it is Christmas, and we
Especially
can
in
always
Florida.
be
It's
thankful.
hard to remember.
Yeah, I know. Especially right now, it's warm. It's
I
warm
know,
right
isn't it
now in
crazy?
Florida. When we're lamenting being at work and having to work at the holidays, we can always focus and be thankful that we're on the side of the table that we're on, that we get to take care of people. And
Yes.
I would hate to be having big operations and surgeries right before a holiday.
Yes.
And so I'm thankful in my life, and
That's
lots to
true.
be
I'm
thankful
grateful.
for.
I have a ton to be grateful for this year, especially, but I'm grateful every day I get to walk out of that hospital because there's people that never will. They've checked in and they might expire in the hospital, which is terrible. But
Right.
yeah, this has been a fantastic year. It's been a year of ups and downs. There's been some great things and some bad things, but can you believe it's been one whole year since we were doing this podcast?
It's crazy. It's really
We dropped the first
crazy.
episode in January of this year.
Yep.
And in spite of all that, I mean, we haven't always been consistent about dropping them every Monday, but we've pretty much dropped how many episodes this year? 24. This will be episode 25.
And
then we have one more big surprise for the end of the year.
We hope to be. Yeah. And I know when we started this podcast, we talked about you settled on wanting to drop one, I think, every week. And I felt like that was really ambitious. I was like, we can try, but I feel like that's really ambitious.
Yeah.
I think our one and educate and produce relevant information in a range of basic things about this to more complex subjects and episodes. And there's so much, we're not even at the end of a list. We're not even close to an end of a list of ideas and things that we want to produce to be helpful to, again, people that don't know about this profession. You're thinking about getting into it, or you are a first assistant and maybe just starting or haven't been. We said it. I said it so many times. I learn things every day, and I've been doing it for almost 13 years. I've been a first assistant almost 13 years. I learn things every day. And so to bring to our listeners where we can learn and extrapolate valuable information. So it's been a lot of fun. It's been work. It's work to do.
Yes, it is. It is definitely. But we wanted this to be a resource for people, brand new first assistants, or maybe people who are in a rural area or whatever and don't have always the palette of big cases, and then when one comes up, they're like, "Oh, where do I have resource textbooks," and we did an episode on professional resources, which is by no means an exhaustive list, and I have textbooks and everything, but then sometimes, I need help with looking up a case I haven't done in a while,
Right.
and if it's a big case, and then I think these little tips and tricks really can help people, I think, and,
Mhm.
it's a work in progress. This podcast has been a work in progress.
Mhm.
I look back at the first one compared to now with the editing and everything, it's slowly getting better, but I think our content is gonna get better, and I think we'll
Mhm.
have more spotlights, like, and maybe little short videos or B-roll or whatever they call it in the
Yeah.
industry, and we may end up branching that out into social media like Instagram. Maybe have an
Mhm.
Instagram page where we put these little blurbs up and,
Yeah.
like, maybe a teaser for the next episode or something. This I think this year is gonna be a great year. We're looking at getting sponsored by somebody, which I think is really great.
Mhm.
We haven't decided yet, but we'll announce that when we do, and we'll wait to get sponsored by Medtronic or another big company like that, Ethicon or something like that,
That's funny.
because I need a MacBook for editing and make it much easier,
Yeah, right.
but no, I just think I just wanna continue I want for us to continue to put out good content, relevant content to people
Mhm.
that would be useful to somebody and can say, and we've already been getting feedback like that. People have
Yeah.
really appreciated some of the episodes we've done. That really means a lot to me
It's
because
really cool to hear
yeah.
from people that we've helped, that just even recently, I had somebody reach out and say that
Mhm.
we listening to our podcast solidified his decision to pursue becoming a first assistant, and how happy that made me, like, fantastic.
Yep.
Like, we need good people in this profession, we need it to continue to grow. I think it was a starkly low number of new certifications for first assistants the first several months of this year, I know, and we're shorthanded, and the more of us that are out there that have goals of elevating this profession and want to do an excellent job and really educate others to what we do and what the role encompasses is just going to help us grow and get the recognition and educate others and make others
Yep.
aware what an asset we are in the operating room. And I fully believe that.
Oh,
And I can say
definitely.
that with no shame and no real arrogance at all. We are a
No.
fantastic
Yep.
asset in the operating room. We bridge that gap between the CST, the circulator, and the surgeon. Really, I look at myself as a surgeon liaison between the surgeon and the team, and just really rounding out that operating room team in a fantastic way when we're doing it right.
I agree.
I count it a privilege to be in this profession. I'm thankful every
Mhm.
day that it became my path, my career path. So yeah, we're going to talk about the year. We're going to talk a quick here. It is going to be a short episode about maybe some of our favorite episodes that we've put out.
Mhm.
And I want to talk too, John, about some goals maybe that we have for 2026.
Definitely.
I've got a
Yep.
couple in my mind right now that we can mention. But I
Sure.
know we started off the year with some of those basic subjects about how to become a first assistant, what even is a first
What is a
assistant.
first assistant? Yeah, that was
So
the first episode. Yep.
if you're listening right now and you haven't gone back and listened to those, go back and listen. We did it
Mhm.
pretty well. We set the foundation. We felt like that would be a good foundation for kicking off this podcast, is talking about what this career is. Um, I would say the surgical history one, was that one of your favorites, talking about the history of surgery?
Yeah, I completely agree with you. I think we are a force multiplier in the OR, and I think, this profession is growing, and I think, especially when we drop episode 26, that is gonna I think this profession is poised to explode. So, I think I think this profession is gonna grow by leaps and bounds when people learn about the potential that's out there. I think it's gonna be a rising tide raises all boats, and I think that's what that and I think that's what this company is gonna do, and we're gonna bring in that in episode 26. And you guys, it's our Christmas gift to you. It
Mm.
could change your life. It could really change your life. So I think it's
Yeah,
gonna change a lot of people's lives and make it a lot easier, a more work-life balance, and hopefully we will be compensated for our worth, the asset that we bring to the surgery and the surgeon. So look out for that.
yeah, yeah. What have been some of your favorite episodes that we've recorded this year?
Oh, I gotta s I hate to say it, but my favorite episode was episode 4, The History of Surgery, even though
Mhm.
I kinda rambled on about that, and I forgot half of the stuff I was gonna talk about, but I just learning about Robert Liston was just blew me away because I wasn't aware of that and of all the contributions that he had and how much of a dynamic surgeon he
Mhm.
was and compassionate and just all that he had done for our profession in such a short time. And he did the first amputation in England with anesthesia, and I think he died a year later. He had done tons of amputations without anesthesia. He was known as the fastest knife in the West End. The guy was a dynamic, gregarious person. He was 6'4". He was huge. He would be very compassionate with patients, but at the time, one guy got off the table and locked himself in a closet, and Liston went and ripped the door off of the closet and dragged the guy back to the operating table and took out his bladder stone. It was a big learning experience for me. And then the one we did it, but we haven't dropped it yet on the father of reconstructive surgery, Harold Gillis.
Yeah.
Yeah. I kind of want to
Yeah.
redo that one a little bit. I think there was some
Oh,
stuff
that's
I wanted to
right.
mention,
Oh, we
but
can't drop
either way, that's still gonna come out next year, and
Mm.
this will be season 1, and then next year will be season 2, so there's
Right.
still tremendous amount. Like you said, we have nowhere exhausted the list of
So
episodes that we
much.
had initially
Yeah.
sat down and wrote out. That's how we knew we were gonna you and I said, "We gotta sit down and come up with at least 10 for this
I
to be
had
viable, because if we can't come up with at least 10, then this is gonna die on the vine."
yeah, 5
And
right off the top
yep,
of my head. I 25
exactly.
easy, and I could sit down, I could
Yep.
still do more and more because it's a thought we talk about one thing and then, oh, related to that, we could talk about this. So there's so much to cover, and it's just a really example of how there's so
Mhm.
much depth to this profession, and there's so much depth and so much to know. One of my favorites was our breast series. I loved our breast series that we
Oh,
did.
yeah, that was a good one, yep.
And especially
Jason was
having Jason on,
fantastic.
he was
Yep.
amazing. I just really yes, I love
He
other
was
people
good.
and what they can
Yep,
teach me, and when they're just really truly experts at what they do, I
yep.
love to talk to
You
people
can
that
tell
know
too,
what
he's
yeah.
dynamic, but he loves what he does, and that comes across in his passion, and I like
Explained
that
it well.
attitude.
He really
Yes.
gave us really good descriptive information on that reconstructive
Mhm.
process in breast surgery. So
Yep.
and just knowing, about doing the lumpectomies versus
Mhm.
mastectomies and when we do sentinel
Yep.
node biopsies and all of the things that go along, the different positionings that,
Yes.
need to happen with each of those cases. Those kind of cases are those kind of episodes are really so valuable. And one of the things that I was looking for at one point when I was looking for a podcast just to listen to in the car that I could maybe get some information from other first assistants, and there was no podcast out there available for us, so
Nope.
that kind of was
Right.
what spurred us to do this, and again, I know we've said it earlier just a few minutes ago, but the feedback has been great. Speaking of, I one of my goals, John, is to create a private Facebook group for our
Oh, yeah.
podcast listeners,
That's
and
great.
I with the purpose of that being a forum for us that we could come and into that Facebook group and kind of interact with one another. We could take comments, we could answer questions, we could get our listeners on things to talk
Yeah.
about, things that they wanna
Yep.
hear about. So that's one of my biggest goals, I think, for the front of the year is to create that Facebook group. We have a public Facebook page right now, but I'm not real happy with, uh, there's not really any interaction on there. I use it primarily as a dropping point for podcast and just to advertise the podcast after you get them edited and dropped,
Mm.
advertise them there, and go on some different professional group forums also to advertise that way, but I really wanna get that
Mhm.
private Facebook group going, and we can interact with people, I think, a lot better because you and I, neither one have been very,
Right.
consistent with looking at comments on Spotify and YouTube.
Oh, no.
So,
Right,
if
true.
you're listening and you've commented and we haven't responded, we are so sorry. That's not
Yeah.
intentional at all. We just are terrible about getting on and doing that, and I feel like the Facebook group
Yes.
forum would be a better way for us to do that.
Yep, something close because where people can talk and be a little more honest and it's not
Correct.
open where
Right.
every schmo can read it. I agree.
Right.
I
Mhm.
think that's a great idea. I think we should do that, definitely. And, yeah, the breast series was also a favorite of mine because we had Dr. Reddy on, and I've worked with her in
Yeah.
Virginia, and I think she is an
What a
absolute
cool episode.
fantastic
Ah.
plastic surgeon. For some and I hate to keep saying it like this, but for somebody so young, she's
Mhm.
just out of residency not too long, a year or 2. She's young. She's just started a
Mhm.
family, but she is I look at her, I follow her on Instagram, and her results are fantastic. She is just good. She's got a beautiful aesthetic eye. She's got great technique. She cares utmost about her patients. They are all she cares about, and she's a good technician, and this is now. I can't imagine how good she's gonna be in 10, 15, 20 years.
Right.
She's gonna be a pillar in breast reconstructive surgery.
How
She's
honored we were that
yeah,
she made
yeah,
time for us to come to talk to us and
yes.
bring that episode. And I will say about that series, and it's our goal with any series that we do is that each episode is a standalone episode. So if you up and hear the cosmetic breast surgery episode with Dr. Reddy, you can just go
Yeah.
on. You won't miss anything or miss a beat. But we did in a series so that you could start at the first episode of the series and go through, and it took you in order of the breast surgeries and kind of get
That's
through to the
post-mastectomy reconstructions,
exactly.
deep flaps. Yep.
And then we went. So
Yeah.
that's I love
Yep.
that one. And we have so many more series that we've talked about
Yeah.
doing.
And she said she would come back again, definitely, so we could do her drainless tummy tuck or her
Mhm.
mommy makeovers that she does. She's
Right.
just phenomenal.
Mhm.
She's phenomenal. She really
Yeah.
is. I think she's great. I was so lucky, and I just ended up in there because nobody else was available that day. The normal person that she worked with was out, and we hit it off, and it was great. And then I'd get in there and work with her every chance I get. She's fantastic. I'm so glad.
Yeah.
That would be one surgeon I would love to work privately for.
Yeah.
Unfortunately, she hired somebody privately, her own surgical assistant, but people move around. But yeah, no, she's excellent. But I love that one. I love leaving the Mayo stand behind. I think
Yeah.
because a lot of first assistants, I don't know, they feel obligated that they need to scrub or that they almost apologetically have to still scrub and
That one's a hot
not the
topic for
fact.
sure. That is a
Oh,
hot
definitely.
topic, and
Yeah.
it continues to be. It's not going anywhere. I say in a nutshell, if you are a first assistant and you have been doing it for a while and you're comfortable scrubbing every now and again and you want to still be in that role, good for you. I say do it. My advice to new first assistants, yet and still that you need to move on to first assisting and get out of the
Yes.
facility that you're in. If
Yep.
they are going to, if you transition from the role of CST and you go to FA school and you become a first assistant, more often than not, you need to change facilities because they're always going to look at
Mhm.
you for that role. And that's the best way that you can hone your first and
Mm.
step into that role
That's
of first
true.
assisting and
Right.
really get in there and just get on that learning curve and start learning
Yep.
the skills and
Mhm.
the
I
knowledge
agree.
and the techniques and whatnot. But it still remains a hot topic.
It
And
does. And not everybody can do that. Some people are
right.
in a rural area with only one hospital,
Mhm.
and God bless them and more power to them. They wanna take on extra responsibility, and unfortunately, they still have to maybe do that as a part of their but this is a growing profession, and more places are recognizing us as a mid-level provider because of the role we fill. We may not
Mhm.
be able to do a lot of the extensive stuff that nurse practitioners do and PAs do outside the operating room, but at the field, there's no difference between them and us. I think that more hospitals are credentialing first assistants through medical staff, which I think is good. More
Mhm.
places are credentialing traveling surgical assistants through medical staff. I think it's a great thing. So,
Right.
yeah, there's nothing but I think good things on the verge for our profession. And I think next year, looking forward to next year. I mean, we've got the joint conference coming up in August.
Mhm.
I'm in Atlanta in April.
April, yeah.
Thank you.
Mhm.
August. I'm already jumping ahead. See, the year goes by so fast. I'm on August of next year already. So
Yeah, we've got that to
it's
look forward
I'm
to.
getting
That's gonna
old.
be
Yeah.
great.
You gotta figure out a way of maybe doing a live stream from there or
Yeah,
something
we're on
because they've been
that.
asking us. People have been
Yeah,
asking us if we wanna broadcast from there, and we really don't know how. Plus, I wanna be a
right.
participant, honestly. And
Yeah.
then there's the Maddox conference, the Maddox Trauma Conference in April. It's just before no, it's just after this year. It's after our surgical assistant conference. I'm definitely gonna go out there for that, and I might do some videos. Maybe I get to interview Dr. Maddox from the
Mhm.
Maddox maneuver, the medial visceral
That would be
rotation.
cool, yeah.
And
Mhm.
he didn't invent it, but it got named after him, so I'm looking forward to that. Maybe some other people out there, some of the big names, if you read any of the surgical papers or listen to Behind the Knife, like
Mhm.
Patrick Georgioff, he's always there from Behind the Knife. Kenji Ianaba from LA County, Demetriades, there's a lot of big names out there. I'm looking forward to it. I'd love to talk to them, see if I could sit down with them, and it's a great resource. It's an expense. I was just looking at it today. The cutoff for the early bird registration is January 8th, which happens to be Elvis's birthday. And yeah, it's an expense. It's 2 conferences. There's a standalone Sunday conference and then a 2.5-day conference. If you register early, you're still talking $1,000
Yeah,
for that conference, which is considerably more than our conference.
it is.
But it's to me, it's well worth it. I don't do a lot of trauma, and to stay updated on all the new trauma, and you never know, you can network there too.
Yep.
I met a surgeon that didn't have first assistants at his hospital. Now they have first assistants, and I see travel positions open there,
Nice. That's
and,
cool.
I wanna reach out to him and talk to him about that when I'm at
Mhm.
the conference about it. What's his impression of the first assistants? Because I know they were putting some of their people through Meridian or Madisonville, I can't remember which school, but yeah, so I think there's that conference is good, and there's the American College of Surgeons. I'm gonna try and get to more conferences this year. I think
Mhm.
we should try and get to them as a podcast,
Yeah.
and bring people open the horizons, widen the horizons for people and show them, hey, you can go to the ACS, the American College of Surgeons, or you can go to the orthopedic conference or the bariatric conference or whatever your specialty is. Go to that conference because that's another huge resource. Like to see that
Mhm.
happen this year. Definitely, I'm definitely going to make the Maddox conference though. That's for sure. I just
Yeah.
it blew me away my first year there. There was 1,500 people there, 1,500 physicians
Mhm.
and mid levels.
Yeah.
Unbelievable.
We live in a world that you can we and I hear this a lot and see this chatter too in first assistant groups and whatnot, is that we don't have people don't respect us, and we don't have the notoriety, and we don't get validated, and et cetera, et cetera. And I just wanna say to that, that it's up to you. That's in your hands. You can
Exactly.
garner
Yep.
respect by elevating yourself and
Yes.
knowing we live in an age that there is no excuse not to know something. You can know anything
Yep.
that you want to know. Now, come on.
Yes.
You turn on YouTube, there's anything I have conversations with my surgeons and learn things about things that they know, pick their brain about things.
Mm.
No excuse at all to know
Nope.
things. And I still work with a surgeon to this day, and he knows full well I read that H&P and wanna know when I can, and
Yeah.
I just in conversation yesterday said, "Oh, yeah, I saw in their H&P where so and so," and he said, "You read that?" And I'm like, "Yes, I read that." And
Mhm.
y we have
Yeah.
opportunities to, quote, unquote, "impress" our surgeons, let them know we're about this. And so you as a first assistant, no matter your
Yes.
level of experience, to
Right.
really know things and show yourself a learned person and show that you have an inquiring mind and you
Right.
want to learn,
And
you
you're
wanna know more
engaged.
and be engaged, I know, and
Yeah.
people will
Mhm.
respect that. They will,
They will. They do. This is a
um
profession where if they know you wanna learn, they will pour knowledge into
Yep,
you
yep,
because everybody in the operating room that I've met loves to teach because they love to learn and they
mhm,
love to be taught, and they've had some significant teachers in their lives. But you're right, Kelly, it's all in how you carry yourself as a
yeah,
professional. And I hate to say it, but I travel, I go to different places, and I see people who are, I hate to say it, and I'm gonna get shit for saying it, but are techs who close skin. That's all they are. They don't
they
wanna be
do.
anything else. They just want the extra money, and I don't really consider that I don't consider themselves to be engaged in the patient care. I consider them to be ancillary personnel, honestly,
Right, and so
because
yeah,
I
if
do what
they're
you do.
carrying themselves that way and they're
Yep,
conducting themselves and that's all that's what their is, then that I'm so
but
sorry about that, ooh, and that's what their standard.
silent.
I know I was
Put
on
your cell
call
phone
last
on
night and I
silent.
forgot to
Yeah,
turn it on back on
yeah,
silent.
uh,
That's what their
yeah,
standard is, then
yep,
that's what the perception of them is going to be. You can
yep,
control the narrative of how people
yes.
perceive you.
They will see you as a peer if you're
Mhm.
engaged, you talk
That's
to them
right.
about surgical technique, you talk to them about the H&P, you
Mhm.
look at the CT scan, whether with them or not, or,
Mhm.
"Hey, doc, can you show me the CT scan? Can you explain it to me?" Because to
Yep.
me, it's like looking at a Rorschach test. You just have
Mhm.
to look at a lot of them and get somebody to teach you
Right.
that and say, "Look, this is this. This is what
That's
this means.
right.
This is what this means. This is with contrast. This is the filling. This is when it's not filled," and all of that. And you will find a surgeon that will teach you
I've
and
never
will
had
respect that,
one say I've never had
and they
anybody
look at
say,
you
"No, I'm not
different.
gonna teach you
Yeah,
that."
that's right. Yep. Yeah.
No, not once. So, we wanna encourage you with that
Yeah.
and leave you with that encouragement to do that. You have control over how
Mhm.
people perceive you, and knowing your scope of practice and your
Mhm.
facilities policies, work at the top level of your scope. Find out those
Yes.
policies and work at the very top level they will allow you to do and push for more. If it's not you
Yeah.
don't feel like it's enough, push for more, push for more.
Yeah. You don't know until you try. If you're not credentialed at your hospital, talk to your director and
Mhm,
see talk to the maybe make an appointment and meet with the chief of medical staff and see if you
mhm,
can what you can do to get started. I remember I was working in Michigan at a hospital, and a new surgeon came there doing bariatrics, and I'm sitting there talking to her before the case, and I'm, like, going over some of the stuff she wants and what she does, and I said, "Okay, do you reconstruct the gastroepiploic arcade afterwards, or do you not, or do you do that? Do you do that?
right,
Do you" and she's like, "You know what? You're the first surgical assistant that
mhm,
I've talked to about surgical technique." And I'm like, "That can't be true." She goes,
right.
"Yes. I go to 2 different hospitals and nobody talks to me about surgical technique." And, it's a
And
way
it's
to
kinda
just
shameful.
show
I mean,
it is.
when they say things like that because more of us should be doing that.
But you know
Um,
what? When we worked together, she let me do a lot more than most other surgeons did because
right,
I earned her trust slowly over
right.
time. "Hey, would you like me to do that?" because it's easier for
Mhm.
me to reach it sometimes. Or sometimes I used to have surgeons that, like, would switch around the table so they could take down both pedicles in a LAVH, let's say. And then over
Mhm.
time, I'm like, "Would you mind if I try?" And they're standing right there, "Okay." And then it became like they don't even ask anymore. They just
Right.
expect you to take down your side.
Great
Be
example,
engaged. Don't.
John, of how you
Yeah.
you have to earn their trust, you show yourself approved, you work for it, and it's little
Yeah.
steps, but these are all good ways of really elevating, like we're talking about, elevating
Mhm.
yourself and your practice and developing that relationship with your surgeons of trust
Yes.
and respect,
Yes.
mutual respect, and, um just letting them
Mhm.
know that, "Hey, I wanna learn, I wanna do good, I wanna think like you, I wanna know what you're concerned about, think along the same lines you're thinking, so then I'll know how to help you." That's the best way to help
Right.
a surgeon, to assist a surgeon, is to know what his or their train of thought is. So,
Exactly.
yeah, we wanna encourage you with that. We're gonna bring a lot more information this coming year. There's lots of things that John and I have talked about bringing to you, talking about different mesh material, hernia series. There's
Oh, yeah,
a whole
definitely.
orthopedic series to do. We wanna talk sutures, suturing materials,
Mhm.
and how to decide what sutures. I think that's a really good
Yep.
episode, John, for
That
especially
would be
for
a
our
great
younger first
episode. Yep.
assistant, keeping up with the types of suturing materials, and I could give I'm not going to right now, but in that episode, I could give a we could both give some really good examples of how that is so imperative to know your sutures
Know the
and the
capabilities of your sutures.
qualities and capabilities.
Yep.
So we just want to tell you
Mhm.
right now, keep listening. We have got lots and lots of good things coming your way, helpful things,
Exactly.
and we've enjoyed this year.
Yep.
And we do apologize if anybody cares that we haven't put that episode a week out, but I'm tickled with our average.
Mm.
We're gonna end the year with producing and putting out 26 episodes in a year. I think that's a
Yeah.
pretty good average.
That's amazing. We
Yeah.
started, like I said, we dropped the first episode on, I think it was January 26th,
Mhm.
and here we are just before Christmas in the same year, and by the end of this year, we'll have 26
Yep.
episodes uploaded on the different platforms, and that
Yeah.
just blows me away.
Yeah.
And then it what you were referencing earlier about the future, where we see the podcast or how it goes, something I'd like to introduce is like a product spotlight.
Yep.
Like, we just worked with a product today, and I'd like to bring that rep on to just
Mhm.
briefly discuss it. It's not gonna be a whole episode, it may be 10, 15 minutes,
I could see
but
that helpful to people, and yeah,
sure,
ourselves included.
because
Just
it
a
may not
really
have
great
gotten to their
resource.
hospital yet, and
Mhm.
then when it does, they have a leg up on it because maybe they've
Mhm.
already heard a little bit about it and know a little bit about it,
Yeah, that's gonna
I
be really
think.
cool to do
Mhm,
that, and that's
and educational spotlight and maybe a technique spotlight or something where
mhm.
we can do a new show people maybe a new stitch or something, or I don't
Mhm.
know, something.
Yeah.
We'll go. If you have any suggestions, please drop it in the comments,
Mhm.
but I do have a question for you though, Kelly.
What's that?
Since it's Christmas, and how much did Santa Claus pay for his sleigh?
I don't know.
Nothing, it was on the house.
Alright. Good
Yes,
cheesy Christmas
definitely.
joke. Yay. Alright, John. This has been
Yep, you
fun,
got
and,
cool.
forward to one more good episode drop this year. It's a big one. It's one that's, again, been a hot and it's gonna be cool to drop that one
Oh,
as
I
our
think it's
last
so good,
episode
yep.
this year.
That's be our Christmas gift to you because
Yeah.
I think it's gonna make our profession explode, and I think it could be life-changing for a lot of people,
Yeah.
so I wish you all a very Merry Christmas and a Happy New Year,
Yeah.
and
Same here.
we'll pick up again with the first of the year, season 2,
Yep. January.
and I'll leave you all with one more joke. Why did Mrs. Claus divorce Santa? Too many hoes.
Thanks. Take that to your OR and tell it.
Yeah, I think that
That's
may
a
be
good
something we should
one.
do on each episode, tell a joke, like
Joke.
maybe a surgical related joke or
Yeah.
something,
Yeah, that would
or that, but
alright.
yes, so, Kelly, I hope you have a
Alright.
very Merry Christmas
You too.
and Happy New Year. Tell David I
Mhm.
said Merry Christmas and
I'll
Happy
do
New
it.
Year, and then,
I'll do
yeah,
it.
we'll, pick it up at the on the flip side. We'll see y'all next year with the
Yeah.
next season 2 of the Surgical Assistant Podcast, and but leave us your comments. If these episodes are too long or too short or there's something you wanna see or hear about, please let us know. We'll do it. We'll do the
Yeah.
research.
Yeah, we're
If
looking
there's a
forward to
guest,
getting after it for sure.
yeah, a guest maybe that you'd like to come on.
Mhm.
I would love to get David Lourier on here that does the
Mhm.
talks about the myopectoneal orifice and inguinal hernia repairs and robotic hernia repairs. I think he's onto something. I think those guys at the Hernia Collaborative are really pushing the technique forward. So
Mhm.
anyway,
Alright. Yep.
Merry Christmas.
Yep. We appreciate y'all. Have a good one.
Bye.
Bye-bye. Thanks for listening today. We invite you to like and subscribe to this channel and leave a comment if you'd like. Feel free to look us up on Facebook at the Surgical Assistant Podcast or email us at thesurgicalassistantpodcast@gmail.com. Until next time. Content of this podcast is in no way intended for diagnosing or treating surgical conditions. No patient-specific information is shared. All HIPAA guidelines will be adhered to.